Hi everyone, Carolyn Zeff here, and in today's video we're going to be reviewing an ELDOA for thoracic vertebrae 6 on thoracic vertebrae 7. Now just to give you an orientation of where this is located in the back or in the spine, we have the back with the musculature exposed here, and you can see the spine coming down here, the back part of the head, and the shoulder blades to the side. Now if we follow the shoulder blade down to the bottom part of the shoulder blade and come across, that would bring us to T7, so the level of thoracic vertebrae 7. Now just above that is thoracic vertebrae 6. So we're actually working with this ELDOA in that mid-back area. Another good reference point, T7 is around where most women's bra straps lie. So T6 is just above that. That gives you a little bit of a different visualization. So I'm going to grab the spine here just to show you what I'm talking about when I say kyphosis, so a kyphotic curve within the thoracic spine. So we have this curvature forward, so the head's here and the face would be facing that way. And we have a kyphotic curve in our 12 thoracic vertebrae. Now, when we look at the spine here, what we're going to really be focusing on is thinking about picking T6 up off of T7. And as we do that, we're actually helping to pull any excessive kyphotic curve up, and not quite straight, but up into a better position using the segmental muscles of the spine to do that. And you'll see within the ELDOA, and you'll feel it as you're doing it, how that works. We're also creating space within the intervertebral disc between T6 and T7, and we're liberating any adhesions or scar tissue within the facet joints between the two vertebrae. It's also known as the zygapophyseal joint, and I'm going to see if I can try to show you what that is here. So the zygapophyseal joint, there we go, that's a good angle. You can see here for the vertebrae above and the vertebrae below, they're joined by two facet joints. And the facet joints allow the spine to go into flexion, which is basically our spine coming forward, into extension, going backwards, side bending right and left, and rotating right and left. So it helps to really liberate so that the joints themselves can move in their full range of motion unhindered. So what we're going to do now is I'm going to demonstrate the T6, T7 ELDOA for you. Okay, so come sitting on the floor and equally distribute your weight between both ischial tuberosities or sit bones. Then you're going to place your fingertips together and lightly press them into one another, and think about lengthening up through your spine, tucking your chin in, and you're going to raise your arms up overhead, and you can stop here for a brief moment just to ensure that you're really externally rotating through your shoulders and pulling your elbows backwards towards the wall. You're going to attain this good upright position, and then when you're ready, you're going to continue to extend the arms up overhead, reaching towards the ceiling or towards the sky. And then if you have enough flexibility and you're comfortable, you're going to press the palms of the hands together overhead. Now, a couple things you want to think about while you're in this position is you really want to think about maintaining a good axial extension from the coccyx or tailbone area up towards the vertex of the head. And you're keeping that chin tucked in. And you want to think about that area that we showed you at the beginning of the video, that T6 on T7 area. You want to think about pulling T6 up and off of T7. And you're doing that by maintaining that upward pull on the arms towards the ceiling. And you're grounding your lower body through your feet and your knees. So you're thinking about pressing your feet into the floor and allowing your knees to fall down towards the floor, or even you can think about pressing them down into the floor. And you really want to maintain that good weight distribution between both ischial tuberosities or sit bones. And you want to hold this position for 10 deep, slow breaths, or about the equivalent, about 1 minute. And you want to think about, in this position, really using your muscular system to get a good full myofascial stretch through your body. Now, when we come out of ELDOAs, we want to do it slowly, just because we don't want to end up with any reflex or rebound pain. So bringing your arms out first, you're just going to bring them down nice and slow, and then you're going to release the lower body, and then the chin and the spine. Now, if you want a variation here, if you're finding you're having trouble maintaining a good upright position in through the spine, what you can do is you can actually place your head, upper back, and hips and lower back up against a wall, so you get some feedback to know exactly where your back is. A lot of people tend to hunch over and find it's tricky or difficult to maintain that good upright position. And this gives you the feedback to make sure that you are maintaining that. Now, you're not leaning up against the wall, you're just using it as a feedback tool itself. Now, if you're finding you're fairly tight through your hips and it's hard for you to maintain a cross-legged position on the floor, what you can do is you can actually roll up some towels or some pillows and just stuff them underneath your knees so that you have something to allow the knees to relax down into, so you don't have to maintain or really hold too much through your hip flexors or through your hip musculature. And then you go about progressing through the ELDOA in the exact same manner we just covered. So that's the T6 on T7 ELDOA. I hope you guys enjoyed this video, and I look forward to doing some more videos for ya.